So the history of PAs, how they began, was back in the 16 and 1700s. The Russian military used citizens as felchers, and they would help Russian soldiers when they were injured in battle. And then in 1965 at Duke University, Dr. Eugene Steed started the first PA program in the United States. And he used 4 corpsmen medics that were from the Vietnam War. And so they finished out the first program. It has grown throughout the years since 1965. In 1980, there were 42 PA programs. In 2010, there were 148 PA programs. And currently today, there are 236 PA programs.
So there are many reasons why the PA profession has become so popular in the last few years. Some of these reasons include more personal freedom than physicians receive, and this is due to less strenuous work schedules, which allows for more personal time, more family time. In addition, PAs add value to the workforce by reducing the shortage in healthcare, and as a result of that, there is a great outlook for future employment for PAs. And lastly, PAs receive great pay for a master's education.
So currently in the United States, there's a risk of physician shortage providers. So this is especially an important topic in rural communities. So in 2010, with the Affordable Care Act, there's an influx of 32 million people who are now insured that needs to be absorbed in the healthcare system. On top of that, the baby boomers are only getting older, so they're now 65 and older, the majority of them. So they're on Medicare, and that needs to be absorbed within the healthcare system too. So with the physician shortage and less physicians available to supervise PAs, this is a big issue. And so one of the ways that PAs are trying to fix this is to focus on optimal team approach practice. So this doesn't mean that PAs would become independent providers, but they would focus on collaboration with other disciplines, especially with the physician. So it's a team-based approach focused on collaboration for improved patient outcomes. So what this would do, it would decrease administrative work for the physicians, and as a result, it would increase patient access for physicians and their schedules, as well as PAs, to be able to work in a collaborative way with the physician to take on this large influx of patients that we now have because of the Affordable Care Act and the baby boomers.